Welcome back. When a loved one is diagnosed with a serious illness, specialized medical care can really make a big difference for the patient and for their family members. If the illness is terminal, a lot of tough decisions often need to be made too, but end-of-life planning can help bring peace of mind and really ease some of that burden on those who will be left behind. And joining me to talk all about this is Dr. Colleen Brown and nurse practitioner Marty Meeks with Ascension St. Vincent Palliative Care. This is something that we were talking about. Should we have this discussion on this morning? And we were like, yes, this is something that I know you both deal with and it's so important. Colleen, I'm going to start with you because even in our newsroom, we're like, what is exactly palliative care and how would you describe that to those that are watching?
So palliative care is specialized medical care for anyone with a serious illness. It is our team is made up of multiple specialties, including physicians, nurses, nurse practitioners, social workers, and chaplains. And it's really a way of creating a holistic approach to care that treats the patient's body, mind, and spirit.
Yeah, but talk about that a little bit more and kind of the philosophy even maybe behind as the hospital. And when you talk about faith, bringing that into the discussion, it's different for everyone, but maybe not someone who has their faith into thinking about how their care and what they want out of the end of their life care.
Right. Well, everyone has their own spiritual beliefs, and many people might consider themselves very spiritual who have never set foot in a church or a synagogue. And so that's part of why we approach it from a multidisciplinary approach. And we get to talk to people about what is most important to them. And that way we get to bring out whatever their special needs or interests or what brings them joy in life.
Yeah, Marty, jump into the conversation here. Thank you for being here. What do you think is really important? What do you want people to know that you think is so important that we give to our viewers this morning?
I think the message about end-of-life care is that it's important to share with your family or loved one or a good friend or even your healthcare provider what your wishes are regarding medical treatment, how you want to be treated, what quality of life is most important to you.
And I know there's a question here too about the message to minorities that might be different that you would like to share too this morning. What would you like that part of the message to be?
Yeah, palliative care is often a scary word when people hear that.
Yeah.
But I think that palliative care is about treating patients or people with serious illness, helping them improve their quality of life, treat their symptoms. I think with minority communities, often there can be a distrust of the medical system, or when they do present to the medical system, they feel as if they're not being heard.
Yeah.
Advanced care planning is a way to have their voice heard.
And that's something that I know you're really passionate about.
I'm very passionate.
And I hear very, very good at as well. There's a health fair that's coming up. What does this health fair do? And who should go to this health fair?
Really anybody.
Yeah.
I mean, it's part of the Indiana Black Expo. It's primarily targeted to Black and minority people, but really anybody can benefit from focusing on their health and ways to improve it. We will actually be there on the 13th as part of a panel. They're having several different panel discussions on everything from serious illness to maternity health and vaccinations. So I would encourage everybody to come and join us, but we're specifically there at 4:30 on the 13th.
Thursday, 4:30, to get any questions that you have. We have about 30 seconds left. What is your final message, or maybe that one thing that you wanted to get out today that you think is so important that you wish people knew?
Just that, like I said, palliative care is nothing to be afraid of. When you hear that word, it's about helping people live well. We want to support people, manage physical symptoms, emotional,
What was that you said?
and spiritual.
What did you say about healthcare forms?
Healthcare forms too.
And healthcare
Yeah.
forms.
Yes.
Yeah.
Okay. For more information, fox59.com/links. It will all be there to give you more information. Thank you both so much for being here. Amber, 9:17 right now.
And we have temperatures in the 70s right